For the rural poor in Cambodia, falling sick comes at a heavy price. Medical care here is hard to find. There are just not enough licensed doctors to go around. Many turn to village healers, but that can be fatal. I'm Steve Chow. On this edition of 101 East, we travel to the remote corners of Cambodia to meet the medics with no license to heal.
In the remote northwest of Cambodia, near the Thai border, the rural poor live a quiet life that revolves around planting and harvesting. The people here are often overlooked by the government and those in the cities. But a tragedy in 2014 threw this region into the national spotlight. Nearly 300 villagers, from babies to the elderly, were infected with HIV. A local unlicensed doctor had used contaminated needles on his patients. Chek Cheoum is now serving 25 years in prison for causing the outbreak. 14 villagers have since died. The rest continue to live in fear.
I'm depressed. I have the HIV virus, and all I think about is death. I'm very angry with the doctor. If he came near me now, I would chop him up.
For many like Mao Sopan living in the commune of Roka, it's too far and too expensive to travel to the district hospital when they fall sick. Instead, they relied on their village doctor. Sopan was pregnant when she went to see him for her fever. She knew he wasn't licensed, but he was there. She trusted him and could afford his treatment.
If people had no money, they could always get a jab from him. They could pay 4 or 5 days later, take their time. Every time we needed him, he would show up.
The outbreak prompted government health officials to rush in treatment. Free antiretroviral drugs keep Sopan alive today and gave her baby a chance at life.
The drugs saved me and my baby. The doctor said it protects the fetus, so I didn't have to get an abortion.
Sopan worries about her young family. She and her husband had to sell their rice field when she became too weak to farm and needed his constant care. To make ends meet, they now travel 3 hours into the woods to harvest wild vegetables to sell.
We have to work because nobody else will look after us. We earn very little money after buying fuel for the motorbike and food for the kids. We must keep going whether dying or alive and try not to think too much. If we don't do this, we'll starve.
Her illness and its treatment still takes a terrible toll.
The HIV medicine has many side effects. I really struggle. I'm always shaking because I don't have enough to eat. Sometimes I can't even stand up, but I have to try. Some of the older people who couldn't handle the side effects of the medicine died.
Roka's villagers did have an alternative to their unlicensed doctor, a local government health center, but Sopan didn't want to go there.
The health center is no good. They give paracetamol for everything, sometimes only half a pill for kids and 1 for adults. If we want something else, they'll say no.
Sometimes people don't need an injection, they just need tablets.
At the health center, senior nurse Bi Beng Saw says until the HIV outbreak, sick villagers were reluctant to come here.
They don't trust health centres because when we prescribe tablets, it may take a while for a child's fever to come down. So they go to an unlicensed private doctor who can bring down the fever fast with an injection.
Beng Soy admits rural clinics across Cambodia are too under-resourced and understaffed to serve the needs of the people.
People living 10 to 15 kilometres away, far away, they look for the nearest health service. The government has difficulty providing that. There are also too few trained health personnel.
Cambodia has one qualified doctor for every 5,000 people, among the lowest ratio in the world. Beng Soy admits unlicensed physicians fill in the gap, providing health care for the rural poor.
The unlicensed ones cover the majority of the country, the remote areas, villages and cities.
The HIV tragedy prompted the government to build this road to improve travel from Roka to the nearest district hospital. But the biggest change is a ban on thousands of unlicensed doctors nationwide, threatening jail and fines. A decision that could cause dire consequences across the country. Among the rural poor who have no choice, unlicensed doctors continue to provide a lifeline. We are about to meet one in a village a few hours' drive from Roka. Around here, Chek Cheoum is the closest thing to a doctor that many people know, but he's never graduated from medical school. His medical supplies are all in this black plastic bag.
People in this village are very poor. Some can't even afford a bicycle, or the $1 it costs to travel to a health centre. They ask me for help. Sometimes they don't pay, because they don't even have enough to eat.
Chek Cheoum knows what he's doing is illegal, but says saving lives is more important.
We live here. People can get to me immediately when they're sick, even at night. If they go to a clinic in Siem Reap, the trip might cost $70 a night. It costs them less than a third of that to come to me.
With his bag of medical supplies, Chek Cheoum is on his way to make a house call. Many unlicensed doctors like him were military medics under the Khmer Rouge.
The military recruited me in 1977 and selected me for medical training in Phnom Penh. I studied medicine until 1979 when the Khmer Rouge regime fell. That's my background in medicine.
Like many here, this man works as a laborer across the border in Thailand.
He has no money for treatment in Thailand. I gave him an intravenous drip with medicine injected into it for the stomach. I gave him another drip to boost his energy because he said he had travelled a long way by road and felt weak. When people fall sick, all they want is to be put on a drip. That's what they always ask for. So I give them what they want.
But he says he's careful with his treatments and knows his limitations.
I throw syringes away after every use to avoid any transmissions. The most difficult to treat is dengue fever, tuberculosis, and infections affecting the brain. I'm afraid to treat those cases. I send those patients to the district hospital or a health centre.
Chek Cheoum's friends drinking with him at home are also his patients. Like many villagers, they are frustrated by the poor service in public hospitals and clinics.
Doctors like us wouldn't be needed if the hospitals did their job well. I've never had any problems. Nothing bad has ever happened to my patients. That's why people keep coming back.
This patient, suffering from hip pain, is back for her second injection. We're looking at what a typical treatment is like. A jab administered on the dusty deck where the men were sitting on only a minute ago. This woman could be among the last of his patients. Chek Cheoum is worried about the government ban on unlicensed doctors and thinks he should stop practicing.
I'm going to stop. I just want to finish up the medical supplies I still have.
In the adjacent village, Tumtue is one unlicensed medic who has already put away his medical bag. Until recently, he performed surgeries for villagers. He stopped a few months ago, but still visits his old patients, like Pel Sum. The two men go back a long way. Pel Sum was a Khmer Rouge soldier, rounding up young men to join the military. He recruited Tumtue, who was 11 at the time. Too young to fight, Tumtue trained as a medic. Years later, they met again after Pel Sum stepped on a landmine. He ended up being treated by the boy he recruited. Tumtue shows me medical reference books from his days as a Khmer Rouge medic.
I was trained from 1984 to 1987, and they gave me this book at the end of it. This was only given to those ready for the job.
He served in a refugee camp hospital for 3 years and performed countless surgeries.
Those who lost their arms and legs were mostly landmine victims. There were also gunshot injuries. Sometimes I had to remove limbs from 5 or 6 people a day. Sometimes there were so many cases, we worked through the night.
While his training may be outdated, Tumtue is frustrated he can no longer serve the people.
People still need my services. They make a difficult journey to see me and refuse to leave. But I'm afraid there will be complaints. I really want to treat them. I was born to treat people. I'm frustrated that I have the knowledge, yet I am not allowed to practice. Because of one careless doctor, people like us are facing a lot of problems.
Travel further into the countryside and you come across the amazing Tonle Sap Lake. Known as the heartbeat of Cambodia, it's the largest freshwater lake in Southeast Asia and home to some of Cambodia's poorest and most remote communities living in floating villages. Hospitals are a long way away, especially in an emergency. When San Sen, a fisherman, accidentally stuck his finger into a meat grinder, his options were limited.
I was cleaning the grinder after grinding fish feed when I had the accident. I lost part of my finger.
He went straight to an unlicensed doctor in one of the floating houses, a short boat ride away.
As soon as I got there, he cleaned my finger, bandaged it, gave me 2 shots and some tablets to bring home. I spent $4.50 for the treatment.
But Sansa knows better than most the risks of going to an unlicensed doctor. His eldest son's left arm is disabled thanks to an injection that went wrong, given by another village doctor when he was a child.
He had a fever and took an injection for it. His arm has been disabled ever since. It shriveled. He was born without any problems.
But there is now hope for those living on Tonle Sap Lake. A group of trained NGO medics take their clinic on the road, or actually on the water. It's no easy task.
Oh, there's a lot of difficulty traveling by boat. In the rainy season, the water levels rise and we sometimes get caught in a storm. In the dry season, our boat might get stuck in the mud.
The lake clinic travels around the waterways to different fishing villages. The team stays in each location for 3 days, providing free treatment. The lake is so huge, it takes them at least a month before returning to the same place. Sick villagers can't wait to see Dr. Kwit Kam San and his team of midwives and nurses. In such a hard-to-reach location, he understands the need for local physicians, even if they're not formally trained.
They trust the local doctors. They use their services because they're not here all the time.
On the day they are here, San Sen is among the first to arrive. His finger isn't healing well.
The village doctor did not stitch up his wound. I don't know if it was because he didn't know how to. If he had been able to come to us, we would have stitched it up. At first I was afraid he would have tetanus. We told him to go to a health center to get an anti-tetanus shot, which we don't provide. What the village doctor gave him is not it.
Sick villagers continue to stream in. Water-related illnesses are common among the people who live around the lake.
People often get diarrhea. They drink water from the lake without filtering and boiling it first, especially the kids. They swallow the water when they swim. Sometimes the kids get an ear infection caused by water entering their ears.
3 ដងដែរ 3 times per day ណែពីថ្ងៃនេះទៅកុំផឹកទឹកហើយលឿផឹកទឹកឆ្អិនអានឹងខ្ញុំឲ្យ
These are some of the habits I'm trying to change.
បាទដោយសារទីមួយគាត់ធ្វើការនឹង
They're always in the water, so their clothes are always wet. So skin diseases take a long time to recover. Lots of skin diseases.
You have itch everywhere.
ឯងអេសគ្រប់កន្លែងហ្មង Yeah, itching everywhere.
Could be scabby.
Yeah, scabby.
The team is also trying to convince women to give birth in the nearest hospital to get better care.
Usually the women say they just can't get to a hospital in time, so they deliver at home. That means they don't get the vaccinations they need.
Pregnant villagers often rely on traditional midwives to deliver at home. Even though by law, such midwives are not allowed to practice.
Pregnant women don't travel in advance to deliver in a hospital because the trip is too expensive. That worries us. They only go if they have birth complications.
But it might be too late when that happens. Ki Kolian is a trained midwife with a Lake Clinic. She works with the local, unlicensed midwives, knowing they have a role to play. Today, Kolian is catching up with Sok Sopi, one of the 3 traditional midwives here. She recently struggled to cope with a birth complication. Kolian knows it's important to raise the skills of the traditional midwives. Old habits may die hard, but Kolian is patient. Slowly but surely, things are changing. But Kolian notices something amiss. Kolian promises to replace the device for free, happy to help the local midwife deliver better service.
I think traditional midwives still have an important role in helping women. They can encourage pregnant women to go for regular checkups. They can deliver a baby at home if need be. And they know the early signs when a woman needs to go to a hospital for delivery.
The Lake Clinic also relies on volunteers from the floating village.
The local volunteers are important to our work. They educate the villagers about basic health care. They follow up on the sick people and update us on any health problems.
Sreta is one of 5 local volunteers from this village. Today, their task is to measure the height and weight of children under 5 and keep track of their growth and nourishment levels. It's a chance to get up close and personal with the families and pass on knowledge on nutrition.
If we had gone by ourselves, maybe they won't open up to us. The volunteer has their trust. She's the one who leads us to the right houses. She knows which ones have children under 5 years old.
In the 3 days here, the Lake Clinic sees more than 100 patients. They work long and intensive days, stopping only for meals.
I work every day and do my best to treat the poor. I feel good about doing this for our society. I really enjoy my work.
The trouble is, the Lake Clinic treats only a fraction of the 3 million people that live around Tonle Sap Lake. There just aren't enough trained practitioners like them across the country, leaving unlicensed doctors as the only hope for too many Cambodians. When we meet Chek Cheoum again, he's about to quit medical practice for life as a farmer.
This is the season of harvest. We've harvested the rice. Today, we drain the pond to harvest the fish.
He hopes a bumper harvest will ease his transition to farming full-time. But deep down, Chek Cheoum still longs to keep serving as a doctor.
In my heart, I still want to help people, but the law doesn't allow it. I can only stop.
If all unlicensed doctors stop treating the sick, many of the rural poor may be left with no one to turn to. The HIV outbreak exposed deep problems in Cambodia's health system. It is chronically underfunded and under-resourced. Until that changes, the ban on unlicensed doctors, while meant to protect the people, could end up creating another healthcare crisis.